Welcome back to Exploring the Spectrum. Today we have with us Honey Rinicella, who is a nationally recognized autism advocate, educator, and nonprofit leader, and is currently the executive director of the Medical Academy of Pediatrics and Special Needs, MAPS, one of the country's most influential organizations training physicians to provide integrative, compassionate care for complex pediatric and adult patients. Honey turned her personal journey with her autistic twins into a lifelong mission to transform care, opportunity, and community for individuals with disabilities, especially non-speakers and adults too often left behind. Thank you so much for joining us, Honey.
So excited to be here. This is so exciting to share our story.
I heard about you from a friend who shared one of your podcasts, and when I heard you speak, I realized that you have so much information, but not just from the parent side. You also understand the provider side. And I would love for us to begin by having you share how you came to do the work that you do, your own
hmm
journey.
hmm So I knew my whole life I really loved the thought of becoming a doctor, which was a little part of the story here. So when I was younger, I wanted to be a doctor, but I knew more than anything, I really wanted to be a mom. And I loved fashion and I loved art and I love arts and science. They're kind of my two favorite things. But when I was looking at colleges, I realized that what I really was made to be was like a mother. And when I moved to Atlanta after college, I met my husband, and right away I went home and told my mom. Wasn't even looking for a husband at that time. I was only 20. He was 31. And I said, I just met the man I'm going to marry. And it was all about his family values and his core values and how much he was Sicilian. He like loved his family, how much he just poured into children. And it was just the most beautiful thing because I feel like we as moms have this internal gut if we slow down and listen to it on how to be a mother. And I really was honed in on those instincts. And it's interesting because my husband and I got married in Atlanta. We had kids right away. He was a little bit older. So we started having children quick. And I had my daughter. And then I ended up having my twins when she was like 21 months old. And they were just shy of 2 years apart. And thank goodness, because I had three kids under two, that I was a little bit younger. I was like 26 when I had my twins. And my boys were doing great. My husband was traveling. I was just like a stay at home mom, living my dream, like everything that I ever wanted, right? I wanted to just love and nurture kids and create like beautiful humans for the world. And it was interesting because my daughter was, typical, and I had almost like a baseline to watch. And my twins, they were doing great, but then something would slide them back a little. And then they were doing great, and then they would slide back a little. And so at 18 months, they slid back way too far. And I went back to my doctor and said, something's really wrong. And that's when they sent me to get some therapy and some evaluations, and they diagnosed him with autism. Now, having that mindset of, the medical component, I am a total science geek. And I started digging really deep into, okay, I know they were okay, but they were like would regress and then they would come back and they would regress and they would come back. And I caught a pattern. So I was like, there's got to be something that we could do. And it was actually an occupational therapist that saw my son fall and he hurt his lip. And she said, I said, he's a tough Italian kid. She goes, that's not a tough Italian kid. That's an opioid effect from gluten allergy, and that's a numbness to pain. You need to get him evaluated for gluten allergy. Now, like my sons are 25 now. This was 23 years ago. I didn't even know really what gluten was. I was pretty health conscious. I grew up on an organic goat farm in Vermont. Like I fed my kids all organic. I breastfed exclusively 16 months, my twins, but I never knew like that component, right? Inflammation, diet, any of that. It wasn't really out there much. So I dug really deep into it, went to a doctor she suggested, and the doctor kind of made sense of absolutely why my kids fell backwards and how he thought that we could heal them to go back forward. And instantly I ran into like almost mommy doctor mode and like my two worlds kind of combined. And I was so fortunate to have the mind to understand as much as they threw at me. I just took and ran with it. So hit the ground running, started seeing, benefit with my kids. took my one kid off gluten and dairy. Like he's like 90% of his behaviors went away. He started babbling again. My one son lost complete language. So he became more alert. We thought he was deaf. And then he like kind of woke back up from the diet change, never got his language back, but was doing amazing. So long story short, we realized maybe the South isn't the best place for therapies. And my husband's company was based in Pennsylvania. So we moved to Pennsylvania when they were 3. And I realized there wasn't a lot of what I had witnessed in Atlanta in this area. So I hit the ground running, starting to educate more parents and eventually working my way up to becoming director of education for National Autism Association, throwing the National Autism conferences. And the more I could heal my kids, the more I kept reaching back to grab other kids to come alongside. And I just needed to get louder to ensure families knew that there's so much you can do. There's so much you can do. This diagnosis is not, it's not the end all be all. Like you can do so much. You just have to peel back, what does the diagnosis mean? And then you have to address the little issues, and then you can help your kid reach their full potential. And it was no longer scary, and it was like empowering to see so many of my friends' kids get better in addition to watching what had done to mine. So in 2022, after throwing my national autism conference after COVID, we came back and threw it. And the MAPS community came alongside and asked if I could take over MAPS because we needed more physicians to be able to support the families. And while I was getting ready to retire, because I thought I'd put in my 20-year card, I realized that that was the biggest need in the community right now is educated physicians to know how to guide these parents, how to help these parents. So I took the job in MAPS, and now I'm the executive director working with the most beautiful humans on the face of the earth, digging deeper to heal our kids. That's my story.
It's a pretty great story, high level view. I'm sure there's a lot more that will come up as we talk. Now, you said something key that the diagnosis is not the end all. Was
Mm-mm.
that your experience when your assessment came back? Like, how did your provider tell you
It was
autism is going
so
to play
gloom
out?
and doom. It was so gloom and doom. It was, I wasn't one of those. I know everybody says, oh, my kid was told to be put in an institution. And it wasn't necessarily that. It was just don't get your hopes up, right? So it was more the professionals kept telling me this is a lifelong disability. There's not much you can do. And I realized right away there were like two camps in the autism world. There were the parents on the one side that would get the diagnosis and they would be like, oh my gosh, it's gloom and doom. There's nothing we can do. We are stuck here. This is the diagnosis. We have to accept it. We have to just reshape our lives and live with it. But on the other side, there were all these parents that were like, but what can we do? Right? What can we do? Is there hope? What's coming down the pipeline? There has to be more. Like, these kids back in the day, it was like 1 in 2,000 when my daughter was born, and then when my twins are born, it was like 1 in 250. So we were in that camp of, well, what's happening? How can we change this? And, there's got to be something that we can address because it's different. And so I stayed away from this camp with the woe is me kind of people. And I never took that mindset. I never took the just accept it. This is what it is. I love my child exactly how they are and as they are, but I also saw that they had, eczema and allergies and asthma, and they had all these issues. My one son had croup nonstop. And I started seeing when I was doing medical interventions that my kids were getting better for the medical interventions, but also that the severity of the autism was lessening. So I stayed really heavily in the other camp of, all right, let's go, throw me whatever you got. Let's keep digging deeper and let's help these kids all reach their full potential. Cause I'm not in that camp that the professionals are like, there's no hope. I'm in the camp of, there's always something we can do. So,
And what you describe of these parents, there's this element of learned helplessness that if
mhm,
somebody tells you that there's no point, then you're just going to be like, well, okay, I guess there's no point. And this is where the providers can play such a massive role. I think
mhm,
providers forget that their words are, especially in those moments when there's a big diagnosis,
mhm,
the words that a provider uses could be a life sentence. It could be so much more impactful than the physician realizes. So it's almost like part of the work for MAPS is reminding physicians how important they are in
mhm.
those early moments.
Mhm. We have a lot of incredible physicians in our network, and a lot of times they're the ones that are going to reshape how the parents need to think, to your point. And I'll use one perfect example. Well, I just did a podcast last week of one of our doctors that was, stating we do something called how to run a practice, and we train physicians how to make it more environmentally conscious for our families coming in, less stimulating for families coming in, how to set things up so that you can run and help shape how you're taking care of these children, if you will. And even one of the doctors I interviewed last week was stating on how we need to educate the parents of what to do when they go to an ER because our kids are a little more complex. And she herself, she's a psychologist, one of our MAPS doctors, they almost called CPS on her because she was using vitamins and supplements. It was like a nightmare story. And she was like, if they're going to call CPS on me, what are they doing to like the average parent that doesn't know how to defend themselves? So we are very big on all of the educating our physicians to meet the parents where they're at, always give them hope. But it's interesting because my doctor, I'll tell you just the one story, and this is like a perfect example of why you're right. Our doctors need to give us the tools. I was having a really hard time. My one son was pretty significantly affected. His name's Vincent. He's in the movie Spellers. He's beautiful now, amazing human. But back in the day, he was really, really tough to do any kind of a blood draw. And we were doing IVIG, which is like an 8-hour infusion for 2 straight days. So 16-hour infusion. And I would call my doctor so stressed at how hard this was for us. It would take like 7 of us to hold him down. We sometimes there would be like 3 of us, sometimes it was just really a nightmare to do this procedure. And I asked her if there was like, should I be doing something different? Should I be giving him something calming and, like extra L-theanine? What should I do? And she had said that I needed to like pause and that I needed to explain to him that this is temporary and he has done it before and that he knows there's an end. So we're going to start it like we've done before and we're going to end it like we had done before. And I was like, well, that's just so simple. Obviously, he knows that. And she was like, just tell him. And like I went back in and I told my son, and the next time he got it, he never had another issue and he just folds his arms out for blood work now. And it was like the power of a doctor just pausing to empower us to find a simplistic tool was like drilled in my mind that day. So to your point, yes, these doctors are so powerful. They can go one way or they can go a complete opposite way, right? They can just say, I'm sorry, I can't help you, good luck with that. Or they could say, let's pause. What can we do? Have you said this to him? And I'm like, no. And she's like, you might want to try that.
And that's an incredible provider because they
Hmm.
thought about what might this child need to hear that isn't what the average kid needs to hear. This isn't something that they themselves experienced. They're
Hmm.
putting themselves into somebody else's shoes
Yep.
by paying attention. And the tricky part is you meet one person with autism, you've met one person with autism.
Mhm.
So what would work for one kid may not work for another, and you yourself experienced this firsthand with your twins. Can
Oh yeah.
you share a little
Yeah.
bit about that?
Oh, yeah, they are totally different. And to that point, what I will share is they're all completely different. They're all individual humans. My twins have taught me that first and foremost, but there are patterns. So, like in that incident, my child, she understood he's going into a fight and flight. How do we pull him out? So that's where, right, we keep putting autism under this, like all these kids have autism, but I wasn't really treating the autism per se. I was treating the fight flight mechanism that kids with severe anxiety have, that typical people walking onto a stage might have when they're an opera singer, right? So this was what I was treating the root cause. So that's like the difference. But yes, with the autism, that's where I have learned first and foremost. My twins are Victor and Vincent. Vincent was completely non speaking, the more chill kid, but less reactive to things. And then my son Victor was the complete like pain in the ass, if I could be so harsh, but everything. I mean, if you opened a door, he would scream bloody murder. Like everything just set off his sensory system. It was insane. I mean, if you banged a pan, he would just jolt and start screaming. Like it's like we were hurting him with sounds. And he was very sensitive to everything. He was the one that had like croup and head to toe eczema, and he had a rash so bad I went through a phase for a couple months that I don't have any baby pictures of him because he was just riddled in this like almost looking like a measles type rash from head to toe, and we couldn't get it. His immune system was just so on fire that we couldn't get him stabilized. When here I have the identical twin who didn't have any of that. Right? They're completely different. And I started realizing one was more medically complex and one seemed like he was more severely affected. So that's when I started saying, okay, we got to look a little bit deeper. So my son Victor, he was a Make a Wish recipient. He had life threatening seizures. By the grace of God, we found the root cause. He had a cerebral folate deficiency and um, had his Make a Wish trip 16 years ago. But once we found that underlying issue, he hasn't had a seizure since 16 years, praise God. He's my medically fragile kid. And then the exact same DNA, because this was one egg that became two, because I have identical twins, doesn't have any of those issues. Like they're completely different. My other son is more apraxic, so he just has more of a brain body disconnect. So he can't really get his brain to control his body, and he will do impulsive things like walk outside and forget to shut the door and like let the dogs out, or he'll walk into the road, or not thinking that he's supposed to be looking both ways, but in his mind he knows he has to look both ways, but his brain can't connect to his body. It's just not listening to it. So that's why he's like our world famous spellers kid. And they are so, 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 so different. Like I couldn't even, I mean, when you meet them, they're completely different. Like my one son Vincent's kind of like a Gandhi vibe. The guy is so sweet. I mean, he's like Mr. Rogers, but almost like spiritual. And he has a blog called The Unfiltered Mind of Vincent. His mission is to try and help others break free from their imprisoned silence when they can't speak. And then I have the other one who is just like the cutest, sweetest, funnest, like 14-year-old boy for the rest of his life. Like he likes pretty girls. He like giggles if somebody says pass gas. Like he's like he's like the crazy sweet kid. They couldn't be more different, even though they both have autism. They both have the exact same DNA. They both had the same upbringing. I mean, it's the craziest thing when you meet my twins. And they look exactly the same, but totally different, completely different.
When you get the autism diagnosis, the next question is, what does this mean? So you
Mhm.
just described two kids that are completely different. You described apraxic, you described medically complex.
Mhm.
What are some of the ways that MAPS educates providers on that next step of figuring
Mhm.
out where is this under the umbrella?
So I think the most important thing, so with MAPS, we don't just do autism, we do like all complex medical needs, right? So we do anything, asthma, allergies, autism, ADHD, anxiety, CP, Down syndrome, we do everything. So the most critical component is what I said in the beginning, that when you have a diagnosis of autism, you really have to kind of like pull back the curtain and see what you're looking at, right? Just like I mentioned, the fight, flight, and the anxiety. Lots of people have anxiety and they don't necessarily have autism, right? So, what are we really looking at? What's the underlying cause that's triggering the mechanisms within their body to act the way that they're acting? A perfect example of how and why we train physicians on this type of mindset of the root cause, look deeper. We have something called the foundations track. So anybody who comes to our conference for the first time goes through our foundations track. Now, foundations isn't like foundations of how do we treat these children. It's really training physicians. So this is critical, and healthcare practitioners, what's walking through your door. We are training them to have a keener lens to look into the child. So is that a cell danger response? Are you looking at a PANS flare? Are you looking at a PANDAS flare, which is neuroinflammation? Are you looking at a potential seizure? Are you looking at, we have like from the mitochondria disorder to the cell danger response to like a seizure to like PANS. We are teaching the physicians to know what is walking through their door. And that's where I feel like we are the biggest difference from any other provider in the country. We're the only organization in the country at MAPS that trains physicians through this protocol. And we have a fellowship program from start to finish. At the end of the program, we put them to the test and we do interactive case studies where our doctors pause and challenge them with what they've learned through our program. And it's just invaluable because to the point of what we're discussing today is when you get the diagnosis of autism, they're like, okay, here's your therapy. You can go do this. We'll write you a script for speech and OT and PT and ABA, or, someone might choose floor time or PRT. And what our doctors are looking at is what's triggering these issues. Like none of those therapies are going to truly get to the root cause of why my son's having the fight and flight. That son that rattled with sound is fine now. He loves fireworks. We have diminished that issue. We worked enough on those issues that he's fine, but it wasn't necessarily any of the therapy we did, right? It was the medical scope of care that we went down the path to say what's a little imbalanced in his body and how can we internally fix that so that he can handle going to school better and that things don't shake him up so much so he's not as rattled or frightened because it was taxing his body. It was very stressful, and when you're in a stress is a toxin, and when you're in a stressful environment, it can really hurt you internally, and these kids need a safe place to heal. So the therapy is important for a lot of our kids, but the body has to be okay. The body's like first and foremost. And these doctors, if you just say they have autism, don't know what does that mean? What does it even mean to get a child's body organized so that they can tolerate ABA or speech therapy? What does it mean? It's not, a doctor isn't taught that in school. There's
Yeah.
nothing taught to our physicians in school about what to do when a child with autism walks in your door. Nothing. Or a complex medical case or somebody with severe allergies or asthma or eczema. All they know is what prescription is going to help that, right? What therapy can I write for? Um, where can I put them? Who can I refer them to? That's kind of the scope of care that our kids technically get today. And that's where we're trying to change it. Like what we do at MAP should almost become the standard of care, especially for all kids in the spectrum.
When it comes to how we practice, so much of how we practice is the standards of care. The
Mhm,
standards of care, if you do not follow them, it is a liability. Like there's all of these things that
mhm,
almost, again, with that learned helplessness, but for providers, it's like, what's the point of learning more? I can't do it anyway
mhm,
because that's going to be a risk. Physicians are not in a position where they can think outside the box
mhm,
and feel safe doing it. So I think the
mhm,
fact that MAPS is giving them all of this information,
mhm,
doctors love information
mhm,
and science, that
mhm,
gives them a little bit more of a push. But I
mhm,
really think it's going to be changing the policy around how we practice pediatrics,
mhm,
pediatric neurology. That's going to be that final straw that makes them have to do this.
mhm,
And I say this because, the conversation with vaccines,
mhm,
it may not be the vaccine itself. It
mhm,
is the vaccine on top of all of the other things that we did not
mhm,
assess at a pediatric visit. Because I
mhm,
remember if a child comes in with a runny nose, but they're due for their shots, they're going to get a shot if there's no fever. But if
mhm,
there's a runny nose and we follow up and we're like, any changes in diet or bowel habits, are they sleeping okay? Okay, you mentioned eczema. If we start exploring all of those things, then we might be able to recognize that a child is already overloaded, that
mhm,
their nervous system is overloaded,
mhm,
their immune system is overloaded. Maybe this is not the moment to add another insult, but we
mhm.
don't do that. That's not in
Mm-mm.
our practice.
Mm-mm. Should be. It should be individualized. That's the one thing that I tell parents all the time. The story about my twins is they were developing on part like at the same time. They were developing fine. And my kids they have a confirmed vaccine reaction. And that's where when at the beginning of the podcast, I mentioned like they had an injury and then it would tax their mito. They had an underlying mitochondria dysfunction. And so it was like when we gave them like two things at a time, it would tax them. And had I spread them out or given them even just one thing at a time, they probably would have been fine. But too many, like at the same time, and what came alongside with the vaccines, like some aluminum and thimerosal at the time, taxed them. But that's when their mitochondria was trying to come back up. But I kept hitting them and I kept hitting them and I kept hitting them. And a doctor should have paused it. A doctor should have had and I loved my pediatrician. I loved him. He's the one who sent me to Emory and was like, "I think your kids you need special help. Something's really wrong." When I went back in after the 18 months and I'm like, they are not the same kids that they were. And they had regressed like a year. And that's when he's not trained to recognize, like I just mentioned, the cell danger response or neuroinflammation or any of that in a pediatric child that might have a reaction. So like, I never attack the doctors. I'm always like, they only know what they know. And if they're not being taught this, how do we expect them to protect our kids? That's kind of why I took over MAPS because when I say it needs to become the standard of care, we're just so used to like lining everybody up and doing the exact same thing. And there's no one size fits all in medicine, and vaccines cannot be the same. And I know that I was on the Today Show with the president of the American Academy of Pediatrics, and he had said to me, after having the conversation, I had twins, boys, preemies. They weren't that young, but they were, born a little bit younger, and that makes them the weakest. And shouldn't I have held off on giving them vaccines? Because I was literally inoculated them when they were still supposed to be in the womb. And he had said that the two things that were the most disturbing, he had said that we know that some children are going to have a reaction to the vaccines. We know. That's why we have a vaccine adverse reaction system and we protect those kids, which they don't really protect those kids, but that's okay. But they say we have that. Parents and professionals can respond and report everything to that database. We know that's going to hit, we're going to hurt some of the kids, but for the masses, it protects the most. And right there, I literally, my heart dropped. I was in the green room. I will never forget it. And I remember looking at him saying, "You're essentially telling me my kids are collateral damage of a program that protects the masses." And he was like, "Yes." I'm like, "Well, then that's essentially Russian roulette." And I would never want to throw my kid off a ledge to save another kid. And I would sure as hell not want another mother to throw her kid off a ledge to save my kid. I'm like, we have got to do better than that. And I said to him, I said, "Why can't we spread them out? Why can't we kind of pause when we see something that's come up?" Just like you said, like if a child has a runny nose, because my one son, Vincent, he was the one that was most affected. He completely lost his language. The other one became really sick, but Vincent just like completely diminished and he was like gone. He was like a ghost. And he was sick when I brought him in. He had a very low grade fever. And they were like, "Oh, we give it to him all the time." And I'm like, "My gut's telling me we should hold off." And they were like, "Nah, it's fine." And my husband's like, "Honey, he said they do it all the time." I'm like, "Okay." So against my better mommy judgment, I went ahead and followed and let them do it, and he was the one that had the significant regression, way worse than his brother, and that's when the apraxia, everything shut down with him. And what's crazy is that when I had kind of shared that story with the physician when we were on Today's Show, he had said to me, I said, "Why wouldn't they have just waited? What is the rush? Like, what is the rush that we have to give these kids this?" And he had shared with me that we have to insert the vaccines where there is a well visit, because statistics show that parents aren't going to come back and get this on their own. So we have to squeeze all of those vaccines into the well visit. So we're cramming like multiple ones in every visit because we have to make sure they get them, because after the age of, I believe he said like 2, kids don't come back as often as they're supposed to. And so parents start slacking off. But when they're babies, if we cram everything in there, then it's going to like fit in the schedule and we can get them all in them. And then I remember my husband was like, "So this isn't about safety and health. This is about convenience." Like my husband was like, "Oh my gosh, what did you just tell us?" So I was all hung up on, the collateral damage, Russian roulette thing. And my husband was all hung up on, we're not even doing vaccines for health. I mean, it was probably one of the most painful days of my life because my husband and I both looked at each other and said, "This is just so wrong. It's just so wrong." And my story is my story. Not every kid has a vaccine injury that has autism. I have friends that didn't vaccinate their kids and they do. But I do believe, to your point, we have a bucket, right? It's like the total load theory. Like we have the amount of insults that our bodies can handle. We all know this. We all are born with cancer cells. Like we all can keep the cancer at bay by keeping our toxic load down. But if we are constantly exposing ourselves to toxins and stress, because stress is a toxin, then we open up and expand that ability to get cancer. Well, it's no different for anything else. So if we have a reaction to a vaccine, something else probably set the stage. I lived in a country club. I'm pretty sure pesticides in my neighborhood probably contributed to setting the stage for my kids. I'd had a daughter who was a year old when I got pregnant. I'm sure she pretty much removed most of my folinic acid, which is critical for brain development. And then add in that I took a prenatal that had folate, which is not good for kids that need folinic acid. And it like set the stage. So here's the total load, right? It's not just one thing. It's just the vaccines for us was like the straw that broke the camel's back.
And everything that you're talking about right now, in medicine, we like to, like I said, have those protocols. The protocols are based on averages, usually averages that don't even represent the full population that is going to be treated in whatever way.
Mm,
And there's this huge push towards personalized medicine. We see this in women's health. We see
mhm,
this in general longevity
mhm,
as a whole industry around personalized care.
mhm,
And with autism, it's like they're yelling to say personalized care is
mhm,
of utmost importance. And with
mhm,
us, you can't just think of this as a nice to have. They're
mhm,
actually mandating it. And if we look at these children and what affects them, maybe we can start actually addressing the mental health challenges and
mhm.
the massive increase in physical health challenges that all kids are experiencing nowadays.
Mhm, mhm. Yeah, 100%. I mean, I feel like to your point, I'm like, when are the kids gonna catch up? Right? Like, so what we're doing, everybody's like, all these women are doing peptides and, all these people are doing GLP, like everybody's doing these modalities to like find out what they need. But our kids who need it the most, the ones like to your point, who are screaming that they need keener eyes and more of a workup, who are developing, right? So we do pediatrics and special needs. So we're infancy through adulthood. And the reason that we say the pediatrics is our niche is because the pediatrics, nobody else is really doing. Nobody's looking at, should we pause, right? Should we pause? What are we looking at? What's walking through the door? We have to retrain these doctors to think, what is that? Because if you can help a child, then you can help pretty much anybody. But it's really hard to help an adult and then know how to help a developing brain that's not yet formed, that's still, struggling, that's still going to go through puberty. Basal ganglia is still open until what, 3? Like we have to be very conscious of what we're doing to a child. But yet everything for the adults is becoming so individualized, but we're not doing it for the kids, right? And they're the ones that are like screaming, screaming. I mean, the disabilities in this country and the illness in this country for these kids is screaming that they need it way more than the adults. So, I mean, MAPS, we sold out our conference this last spring. We usually have like 600 in person, and there really should be 6,000. There really should be 6,000. I mean, that's when we start winning, when doctors start recognizing what's walking in the door and they start individually saying, "Oh, hey, you have autoimmune issues in your family. We might want to pause for a minute. Let's just make sure. Oh, hey, you think you might have had a reaction to that last one? Let's just hold off a little bit." Like they're cramming so much at a convenience, right? So if you just pause a little bit and the parents understand, okay, we'll revisit that at the next visit, then we're not really hurting anything. It's just really honing in on what that child needs. And we do not ever want to inoculate or vaccinate a child and injure them to hopefully save the kid sitting next to them in church. Like that just is not okay to me. It's not okay. We can do better. We can individualize medicine. We can find what works for them. So it's a tough one for me watching everybody run hard and fast with everything that they're doing for the adults, but nobody's focusing on the kids except for us.
I mean, that was one of the reasons why I left pediatrics or medicine in general because I saw what we were doing. I'm like, hold on, we're not doing preventative care in kids. If ever there's a time to practice preventative medicine, it
It's the
is
children.
the children.
Mhm,
And I want to kind of go back to what you said because in the beginning you said when you slow down, you can hear that gut
mhm,
instinct.
mhm,
And you were in a situation where there was a power dynamic. The
mhm,
physician, they could be the kindest physician
mhm,
like in the world, but there's still that power dynamic.
mhm.
And for parents, like they'll get that gut feeling, they feel unable to really voice that. How do you navigate that? Like what advice, because you've worked with parents for so long, what kind of
Mm.
advice do you give them? And then alternatively, what is the advice that you give physicians to make sure that the parent's voice is heard?
Well, for the parents, I usually start off by saying, find a MAPS doctor, right? So I myself see a MAPS doctor. My daughter sees a MAPS doctor. Like And why do we see a MAPS doctor? Everybody's like, "Well, you don't have autism and you don't have special needs." No, but these doctors are trained on root cause medicine and they know what's walking in their door. So the first thing I tell parents is go to our website and find somebody. If you can't see them in person, there's nobody in your area. We have a ton that do telemedicine, right? And we are working really hard on giving scholarships to physicians that take insurance, right? So we're trying to give these humanitarian humans that take the insurance and can only do stuff in 15 minutes. If they walk in the door, they might not be able to do the full workup on everything, but they can at least recognize, let's pause. Let's pause right now. I learned this might be a cell danger response. We might not want to move forward right now. Or we teach them to say, hey, listen, I think you might need to go see a GI specialist. That really looks like that behavior might be a gastrointestinal issue, right? Or a gluten allergy. And they're going to know how to pause and like send them to the right people. Or they're going to say, instead of Miralax, let's use magnesium. Like there are little clinical pearls that they're going to learn from us. So even if the child doesn't have something, or if it's a 14-year-old that's just going through puberty and struggling and raging or having anxiety or whatever, I send everybody. Everybody hands down to a MAPS doctor, everybody. And then when it comes to the physicians, the families are more empowering than they believe that they are. So we had that conference here in 2022, and I personally rallied up like 18 local physicians to come. 7 states are within a 2-hour driving distance of me. And I rallied 18 people in my own little state to say, you have to come and know what's walking through your door, right? You have to come. I'm just one mom. I'm just one mom. If every mom went and found people in their community that knew what we were doing at MAPS, that understood the critical component of recognizing what's walking through your door, regardless of age, then they should become the voice, right? We started a whole program on our website called Invite Your Doctor, Recruit Your Doctor. They could print out a flyer and say, today's medicine requires keener set of eyes. We want you to go to a MAPS conference. And if they really are tight to go, then we help to fund it because a lot of our pediatricians are in healthcare systems where they provide free education. Well, we are a CME conference, so why would they take ours when they could get it easily at their office, right? They'd have to close down their practice. They'd have to stop working for the week. They have to travel. They have to pay for everything. So we do offer scholarships for those doctors just because we really want to give them the tools, especially the ones that take the insurance, because they can start sending others out. So I feel like it's two part. Like the parents really do need to listen to their gut, find the people that understand this mindset. And I'd rather not see a doctor than see somebody that doesn't get this. And I will say one other thing when we as parents, like inviting doctors was one area of strength that we have, but we have an innate ability to figure things out. And there's an organization came out about 10 years after I was on this journey called the Thinking Moms Revolution. And it was basically like, just stop and think. We just need to teach moms to stop and think. Stop and think. If my kid has a runny nose, does that kid really need to get a vaccine today or could I just come back? Could I just cancel my appointment? Do I make this a sick visit, come back for a well visit, right? Because insurance bills differently. So I was like, what an amazing concept. And to that point, when I first had my daughter, I remember calling my mom and I said, oh my gosh, like everybody was sleeping on their stomach. And then they changed it to side when my daughter was born. And then, with my twins, it was like on your back. And then I remember calling my mom going, I'm so stressed. And what about this? And I read 14 books and I love to be educated. I am like an education geek. Like I do my research and then some. That's just how I function. And my mom was like, throw your books out. You don't need education on being a mom. You were made to be a mother. You live for this. You just need to listen to your heart and you need to trust your gut. And that was probably the best. From that point on, I never read another book. I never, I just was like, there's just no point. She was right. She was right. And everything got a little bit easier. And that's why I loved when the Thinking Moms came out. I was like, my mom told me that best advice I'd ever gotten as a parent. We just need to pause and think. Like we can listen to our gut. We can trust each other and we can phone a friend, right? You find other moms that think like you that trust their gut and you can call them if you don't know and you can still go to the doctor, but we do have that incredible ability to understand what our children need. I just feel like we get so busy in life that we suppress the voice within us that trains us how to care for these kids. Because that day that I gave my son those vaccines, in my head and in my mind, I was like, he's sick. This is really not okay with me. But then again, I was thinking, he's the doctor. He's way smarter than me. He knows what he's doing. He's not going to hurt my kid. He's a lovely man. He's so kind. But again, they only know what they know. So now looking back, oh my gosh, I just wish that I was a little bit stronger. And then I would have said, I'm going to hold off today on that one, you know? So, oof, we have to keep coming back to being moms, but we also have to, as parents, we don't need to be seeing doctors that don't know how to help our kids.
And the energy being spent to try to convince a physician of something, like and I in the psychedelic space, I used to tell, people who, wanna tell their doctors, like, "Hey, I know you've been treating my depression for 20 years, but I just had mushrooms and I'm better." Like, that's when you come to a physician who has dedicated their life to doing no harm, to helping people,
Mhm.
and you present to them information that you think it's amazing new information, but to the doctor, it's an assault to their sense of self because they're a
Mhm.
knower of all these things and they're a helper, but they couldn't help you, and there's this thing. And I said to them, "Be gentle. Give them data." That's doctors love data, and realize that for a physician to realize that they have been doing harm by giving you certain medications,
Mhm.
like, that's a challenging thing for a human on a
Mhm.
human level outside the power dynamic. So, I think in this case as well, if you're coming to a pediatrician that doesn't know better, but maybe they're open,
Mhm.
how can you deliver that in a way that honors their humanity as well, of, like,
Mhm.
not shocking them so much to because otherwise, if you shock them, they're gonna just get
Yep.
defensive.
Mhm.
But if you create a conversation, you might change their life, their
Mhm.
perspective, and
Mhm.
how you said on our previous call, that one doctor could then change the lives of dozens, hundreds
Mhm.
of people
Mhm.
after.
Mhm. Even thousands. I know that's why when so when I did all the parent support for 20 years, I love the parents and I love nurturing them and I loved seeing my friends' kids get better and it was amazing. But then I got into maps and then I realized I help one family. And that family might tell another person and that's great. And they can help their family. But I help one physician. I help like dozens, hundreds, thousands of kids. And then I help thousands of families and they go help, their neighbors and their friends and whatnot. So it really became evident to me early on. I almost had wished that I had taken over maps. They'd asked me a few years prior, and I almost wished that I had taken it on right in the beginning because I realized that the physicians are the ones. And to your point, we don't want to make them feel bad about this. We just want to say, hey, there's some here, like to your point, here's some literature. Did you know that, the gut microbiome being shifted can cause X, Y, and Z? Like they have no idea. They have no idea. They don't know anything about this. They don't understand the diet. If somebody says the diet's a fad, they are highly uneducated and a parent needs to run away from them. Like there is so much that we know now that if doctors aren't at least a little open to it, then they're not our doctors. They're not the ones that you should be taking your children to, in my opinion. We should run the other way. And to your point, like if you bring them the educational materials and you share it with them, and everything that we do at MAVS is all science based, research based, it's a CME education. So, which is certified medical education. And so, if we're presenting the data, we do what's called translational medicine. So, we take what is being presented, we analyze how to utilize it, and then we train physicians how to implement it, right? So if we're showcasing how you can heal a child with certain modalities and somebody takes that information to a physician, they should be like, wow, that's amazing. Right? I want to, like these doctors get in this business because they want to help children or they want to help kids and they want to heal people. And I think I may or may not have mentioned this to you, but I had a doctor contact me from Cleveland. He was in the Cleveland Clinic and he reached out to me and he had said, somebody told me I needed to talk to you. And I said, well, why do you need to talk to me? I'm just a mom. But he was like, I need to talk to you about maps. And I'm like, okay, what about it? I was like, oh, are you going to come to our conference? And he was like, somebody told me I needed to find you guys because I went into medicine because I wanted to heal people. I wanted to help them. I wanted them to get better. What I realized after doing this for 20 years at one of the top institutions and hospitals in the country is that all I'm doing is putting band aids on everything. I'm writing scripts, I'm putting on a band aid. I'm writing a script, I'm putting on a band aid. I'm healing nothing. And that's not why I got into medicine. And I was like, And he was like, so I walked away from my practice. And I'm like, I love it. Welcome to the family. So that's like, and but what we get so caught up in our day to day. I mean, I think it's the same with any of us. It's the same with any profession. Like you can have something in your house and you can say, oh, I'm going to leave this here. And then you can get accustomed to it being there. And then you never recognize that it needs to be put away in the first place because we just get so conditioned to our environment. And that's exactly what's happening to so many of our physicians. So many of our physicians, they just get in the pattern and then they get so caught up and they're just trying to do the best they can for all these kids and they just need to pause. They just need to pause and say, am I doing what I went into this for?
Like 6 or 7 years ago, I came across this video, and it was a physician talking about burnout, because burnout is so rampant in the healthcare
Hmm.
professions. And he said, he's like, "It's not burnout. This isn't that we don't know how to do tough things. It's moral injury. It's actually
Hmm.
knowing that you're not doing the best by your patients and being unable to do it differently because of the system."
Hmm. 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 I could see that. And that to that point is why a lot of our doctors go private. Right. So they only have so much time and they can only utilize so many different modalities. And if you're in a hospital setting, they're going to want you to push me or relax as opposed to magnesium. But if you're in a private practice, you can do whatever you want within rationale, right? Within reason. So I feel like that's huge. Like this is why a lot of times people get really mad that our doctors don't take insurance. But just like that doctor had told me when I was on the Today Show, right? You're following the protocols based on what the insurance pushes you to. And so these people complain, they're like, oh, these private doctors are 400, $500 an hour or whatever. I'm like, those 15-minute appointments are $250 an hour. It's what the insurance companies bill. Here, our doctors are making a lot less than that. Like, and they have to pay their staff and they have to, it's just the system's a little broken right now. I'm hoping that we can eventually get better. We're working on a lot of stuff that can hopefully earmark. There are a lot of people working on right now giving more time allotment for somebody that has a disability, somebody that has like autism. You cannot see a child with autism in a 15-minute appointment or a 10-minute appointment like a typical pediatrician can. I mean, half the time it can take the kid 10 minutes to get organized enough to sit down and let them do the exam. So there's a lot of things that we need to fix. It's a lot of stuff that we're pouring into MAPS. We're working with another doctors coming alongside to teach physicians what to do when the child's in the room. We're trying to always do better, right? And every doctor at MAPS is volunteer based. We don't pay them. We pay for their travel to us. We don't pay them for their lecture. Everybody, that's what makes us stand out too. I always say, like, we're the humanitarians of the world. Like, these are the physicians. I love these people because it's like the St. Jude's, but if you've ever seen the TV show House, they're like the brilliant minds of the house doctor, but then they're like the humanitarians, like the St. Jude's, where they just want to work for free and like help the community do better. Because when you know better, you do better. And they're all the conversations in the hall are amazing. I mean, and people will support each other and connect with each other, and it just levels everybody up. It's one of the reasons we don't go virtual is because we love the conversations in the hall. They need to be with their people. They need to prevent that burnout, right? They're all in it for the good reason. They're all good doctors. They all went in this to be a good doctor. They just have to find themselves again. And I really do think that MAPS is, it's like when I throw the conference, I always tell the hotels, listen, this is like a Airbnb for like my family. This is me inviting 600 of my favorite humans in the world to come here and share dinner and break bread. These are my people. You have to take care of them. I am so particular with the venues that I utilize because I'm like these people are the rock stars saving the world. They are saving humanity. Like they are taking the time, they're helping our children, they're trying to do better from what they were doing before. And it's just a beautiful thing to witness. It's so empowering to see we grow. When I first started with MAPS, I'll just give you a little stat. I used to throw the National Autism Conference and I threw parent conferences for so many years that when they started doing conferences for MAPS in 2014, they asked me to come alongside and help them. And I'm like, absolutely. I love what you guys are doing. And I knew most of the doctors because most of them were my presenters. And so the first time, obviously, it was like 80 new doctors, but then it was always the same 80 doctors every year. They'd have like two new ones a year. We had a call today with our team and we were like 2.5 months out and we have like 70 something already signed up that are brand new first time people. That gives me so much hope. The new ones are where my heart, I like get so excited. I get so excited that last year we had almost 200 brand new physicians that came to MAPS that had never been, never heard any of this, that had wanted to walk through that foundation's door and say, what am I looking at? Right. That gives me so much hope because we do a conference every 6 months. And every 6 months, we see more and more and more. So it shows me that people are getting what they're doing for individualized medicine for adults and women and men. They absolutely can be doing for our children. They're coming into the world. Like it's coming. It's not coming fast enough, but we're going to get there. We're getting louder. When Dr. New took over in 2022, he brought me alongside. He said, you got to make this, you got to get out there. It's everywhere. It's everywhere. It's no longer a small club. Break down the doors. Anybody that's in healthcare needs to be here. If they're a nurse, they're a nurse practitioner, if they're a homeopath, if they're a chiropractor, we all need to learn from each other. These doctors need to learn what's going on in their community. And so that's when we started to get louder. We're doing podcasts, we're sharing with people. When kids gets better, they tell another parent, the parent mentions it to the doctor. You know, we ask doctors all the time, how'd you hear about us? And it's wonderful. Like peer will tell them in their office or a family will tell them. It's just incredible to see how we're slowly infiltrating. And it's just the ripple in the pond. It's just going to get a bigger ripple.
I am a full supporter of getting this education out there because the comparison with MAPS, the psychedelic organization, it just
Mhm.
keeps coming to mind, but
Mhm.
it's
Mhm.
the information is out there. Our job is to pique someone's curiosity.
Mhm.
I also saw the impact of having conversations with providers who, like at this point, it was with psychedelics. They were like, wait, there's others talking about this? And I was like,
Mhm.
yes, come.
Mhm.
So I
Mhm.
imagine a similar thing here.
Mhm.
It's normalizing thinking outside the box, letting them
Mhm.
know that they're not alone and that
Mhm.
there's actually answers to the questions they're posing. And
Mhm.
here's where you can go. And I love what you said about the in person meetings. It fills your cup to
Mhm.
connect with somebody who is saying what you say, that believes in what you believe.
Mhm.
It gives you hope and motivation to keep going because you kind of go back to wherever you are, knowing that there's a growing army behind you.
Mhm.
And that's very empowering. So I love that that's your vision for these
Mhm.
events.
Mhm. I love there's nothing better than to walk up to a conversation and overhear two physicians talking about the complex case that they're dealing with and see how they could relate to one another. And what have you done? And what have I done? And oh, have you thought about this? And it's just so beautiful. They're not going to a conference talking about their golf clubs, right? Like, what did you hit with last weekend? Like, that's not our people. Those are not our people. These are the world changers. These are the people that have the heart to help and to make a difference. And it is just, it's truly one of the most, I mean, as the volunteer, I was like, I'll pay my own way to come volunteer for you guys. They're all volunteering their time. Like all of those doctors, we have 48 doctors up on those stages. They are all closing down their practice. They are all coming to be that person to be with their person, right? They're there to find their people, like you said, with the community. Like and a lot of our doctors do hand over crossover, and so a lot of like the psychedelics will come into, you know, our kids with like the severe anxiety or the fight flight, and you know those are the kinds of conversations that, you know, we can't put some stuff up on a stage yet because there's not enough scientific literature to support it yet, but they're conversations that can be had in the hallway, right? So have you tried this? So it's where we hear all those conversations, and I just can't even express like how honored I am to work with these people. They are just the most beautiful humans. I loved volunteering to help them when they first got started. So now it's like a whole nother level of honor to just see what they're doing. And when we do a call for abstracts, we get hundreds that are sending these abstracts in. And it just shows the amount of effort they are putting forth to try and bring forth change. Like we're doing like redefining autism for our plenary that's coming up this September in Philly. And the whole point is like what you and I started with, right? We can't just say it's autism. We have to really kind of pause and look at what we're looking at. I have identical twins. They had totally different issues that needed addressing. So we're redefining autism when what people what people sent us was insane. It was just insane. I mean, everybody was like, "Oh, there's this, and oh, there's this, and oh, there's this, and oh, there's this." And then we were like, how are they ever going to choose?" And we have like a protocol of how they discern who goes where. And then afterwards, I actually had I have a right hand and a left hand, Katie and Kathy. And I had texted Katie and I'm like, we got to do podcasts to start getting what we're not able to put up on the stage out there because the content is just so amazing. These parents and they need to hear, and the doctors that they're seeing need to know this. So even to that extent, if a parent hears a podcast that we do for MAPS, they're primarily for the physicians. But if a parent is like, ooh, that might be something my physician wants to see or hear or learn about because it's relevant to my child, they can take that content and they could share it with their physician, you know, and if they're a good physician, they're going to want to listen. I know these doctors are all busy and they don't want to be bombarded with what parents are bringing in, but if it's going to elevate their care and they say, oh, there's an organization, the only one in the country that brings in the complex scope of care mindset and root cause modalities, could you take a peek? They're going to want to. They should want to. If they're in it for the right reason, they should want to take a peek.
I love how passionate you are when you speak about this event. I think that MAPS is lucky to have you because you also bring all of this parent perspective and you get to bridge that gap. And just even in the way that you're able to give advice to both sides, I think
Mm,
that's so key because it's not us versus them, it's not parents versus physicians. It's
mm-mm,
really how do you bring all the people who are looking at things differently, open to possibilities, how do you bring them together for
mhm,
collaboration? And this is it, I think. So
mhm.
I'm so grateful that you came to share about this. Where can people find you to connect with you personally, to learn more about MAPS, to find out about the upcoming events? Because, you have this one coming up, but you said every 6 months.
Yep, 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 yep. We usually do a spring and a fall, and this one's going to be September 10th, 11th, and 12th. And we do a physician conference. And when I stopped doing the National Autism Conference, nobody really picked up the ball to do that. So it's been a couple years. And so this past spring, I said, let's do a parent arm. Whatever we're training the physicians on Thursday, Friday, and Saturday, we need to educate the parents on. So moving forward, we're going to do a 1 day plenary track. This one is redefining autism. The one we just did prior was all on toxins. So what we're doing is we're sharing with the families what they're speaking and learning as a physicians because we want to help these families run faster, right? So if the parents know why the professionals are doing what they're doing, they're going to understand it, they're going to get behind it, and they're going to be able to go forward and make more sense of it. And they'll also be able to see what maybe could fit their child and bring that back to their physician to say, how can I help? So Thursday, Friday, and Saturday is professionals only, but we're having a 1 day track. It actually opens up on Saturday evening, and it's my favorite thing. We do roundtables. We do roundtables where you pick a topic. We have like non-speaking table, apraxia, we have seizures, we have mitochondria disease, we have PANS, we have pandas. So we have I believe we're up to we have 13 tables where the parents can come in and sit with an expert in that field. And then they rotate. And then we ring a bell and then you go sit at another one. So I tell parents, what are your three biggest issues? Bring that, sit at that table and like pick somebody's brain for a half hour. And then all day Sunday, it's the 1 day power track of everything that the doctors are learning. We're giving the parents a power hit of what they need to learn. And before this one, we're actually having our board, how we do the foundations track, we are creating something kind of similar for parents. So we're putting it together right now. Our medical board is putting together a foundations track for the parents that they will get when they register. We will say, watch this before you come and keep it for your reference back to it. And this is what we're going to have moving forward. So they get their head about what they're looking at before they even walk through our door, right? We're trying to really level the parent education up to understand what the doctors are talking about. And I think it's so incredible. And I tell my physicians all the time, if I'm not being a good enough cheerleader, call me out. Like I love them. I mean, I've seen so many of my friends' kids heal, benefit, change their lives for the better because of these physicians. So, I love that we're supporting the parents a little bit now. And that's virtual for the parents. So anybody who has a kid with autism should be watching that. But the in-person is obviously the way to go. Like, I mean, you gotta be with your own people there too, right? Because remember when I said there's the people over here that are like, "There's no hope," and then there's the people over here that are like, "Let's go," and those are our people. We usually have the "Let's go" people. It's really encouraging. So we're medmaps.org. So medmaps.org. And your practitioners can go in there and look at our content. But we have a tab for parents. We also have a clinician directory that's great for parents. And when you click on the tab for parents, it will drop down and say conference information. So it's incredible content. I mean, I love these doctors. We even had a handful of doctors at our last conference say, can we stay just to be there to support the families? I literally want to cry. I mean, they're the most beautiful humans in the world. I don't even know how I can even scream it louder, but literally, I'm like, of course you can stay. Like, you want to stay to help all these poor parents that are like so overwhelmed. And I have to figure out how to get better at that because so many of them want to stay. I'm like, maybe I just put up a ask the doctor booth instead of a kissing booth like somebody has. Like, I put up a like pick the brain of a brilliant mind for like 20 minutes and maybe we rotate our doctors. So we have to figure something like that out. But it's amazing. It's beautiful. You know, I'm hoping that you can join us. It's absolutely incredible to see how we're really reshaping healthcare, and it's just the tip of the iceberg. It's going to explode.
Amazing. Thank you for all of the work that you do. Thank you for coming and chatting, and this will not be our last conversation.
Yeah, I'm thinking you're my new best friend. Meant to be serendipitous.
Absolutely. Thank you.
Thanks.